Um, just to introduce myself, my name is Barry O'Riordan. I'm the Manager of Economic Development Coaching with the CVRD. The topic we're discussing today on this coffee chat is mental health and well-being within the context of COVID-19 and the couch and business community. Before we get started, I just want to acknowledge that we're meeting on the traditional and unceded territory of the Coast Salish people. For just some housekeeping, and I think more people will be joining as we go along here. This will be an informal discussion, so we welcome participation from anyone that is joining us on the call. The session is being recorded, so folks who could not attend can watch at a later date. So if you're not comfortable having yourself recorded, then leave your camera off. If you would like to share your perspective or to ask a question, you can do so in a few ways. Because it's an informal discussion, you can simply just turn on your video and unmute yourself and join the discussion and ask a question or make a comment to any of our panelists here. Alternatively, you can use the chat function, which is located on the bottom of your screen. You'll see a chat box that you can open up and you can ask questions there. And if you want to stay anonymous, you can send those questions directly to Community Teachers Couching, or feel free to share them with everyone if you're comfortable. If you are not speaking, I'll just ask that anyone would keep your mute on. So there's a little mute button on your screen that you'll see on your bottom left-hand corner. And that's to avoid any noise quality issues. So any of our panelists, your panelists can probably leave your mic on the whole time. If we have issues, we can ask people to mute it. Otherwise, people end up talking and no one hears them. So helping us in this conversation today are a number of guests. Nick Booth is the General Manager at the Ramada Duncan Hotel and Conference Center. Welcome, Nick. Jodie McDonald is a registered social worker and counselor in a private practice in Duncan. Thanks, Jodie. Ben Kotler is a registered clinical counsellor who operates in a private practice in Duncan. And joining us today is Graham Blackburn, a medical doctor, family doctor working in a family practice and also with Island Health here in Ketchian. So welcome, everyone. Just to get us started, maybe I can give a little context as to why we're having this conversation today. And then I'll have the guests introduce themselves. So in mid-May, following the announcement of the BC Restart Plan, Economic Development Couching and Couching Strong Partners undertook a business survey in Couching to assess the impact of COVID-19 within the Couching business community. The results confirmed what we all know, that the economic impacts have been really stark for the region, particularly within tourism, the restaurant industry, and recreation sectors, but also for many other business and nonprofit sectors as well. Kind of one thing that jumped out in terms of those stats was, at that time, 62% of businesses were receiving revenue reductions of at least 75% within Couching, which is startling. But also included in the survey were some open-ended questions on mental health and well-being of business owners and staff. And those responses that we received were equally stark and revealing. Because they were open-ended questions, we summarized them into different themes, but having read through each of those individual responses numerous times, it really struck me how severely this has impacted the whole community in terms of mental health. So just some of those stats that came out based on that summarization was that 26% of business owners felt that they were exhausted, have no energy, were overwhelmed, were experiencing anxiety or depression. So it's maybe a very broad lump of people, but those were the clear impacts. 31% said they were stressed or very stressed, with 3% saying they had stress-related illness. And 13% identified that they were severely negatively impacted by the event, while 29% said they either had no impact or a minimal impact, or that if they had an impact, that it was improving at that time as things were opening up. So maybe just to get us started, perhaps I can begin by asking each of you to introduce yourselves briefly and describe the work that you do, and then we'll move into a kind of broader discussion. You're top on my screen there, Ben. Would you like to introduce yourself, please? Thank you.
Sure. So my name is Ben Kotler. I'm a clinical counselor. I've been in private practice for about 18 years, and I've moved around the island and settled here in the Cowichan Valley for the last, I guess, 5 or 6 years. And really love it here, and here raising family. My practice has, it's always been private practice, and it is focused on individual mental health issues, relationship issues, some family counseling, and currently I'm working with issues of sexuality. The other work that I do that's not really private work is I've worked for many years with a contract with WorkSafe BC, working with psychological effects of workplace injuries and also psychological injuries in the workplace and the effects of that. So a lot of depression, anxiety, trauma are themes that come up a lot. Of course, the effects of COVID are kind of unique in some way, and have, I think, exacerbated some of the other issues that people have been facing in their lives.
Thanks, Ben. Yep. Jodie?
Sure. So I'm Jodie McDonald. I'm a registered social worker. So a lot of my career has been spent working in nonprofits and frontline practice, and then I've had a private counseling practice for the last 10 years. And what I see in my practice is similar to what Ben said. It's sort of like COVID-19 has been a great amplifier. So if people already had a tendency to overwork or to ignore some of the feelings that they have, or if their relationships had conflicts or issues, the stress that COVID-19 puts on everything is kind of like just makes everything bigger. So in my practice, which has shifted quite a bit, I used to work in Victoria 1 day a week, and now my practice is primarily online. And similar to what you're saying, Barry, about impacts on business, I had a few months there that were a little scary, but I think that a lot of us have had to really adapt and change and figure out how we're going to continue to provide the services or the products that we provide. So now in my practice, I talk a lot with people about the impact of COVID-19 on their mental health, and particularly around things like coping, like if they have, I like to distinguish between positive coping and negative coping, and especially like for people to understand how, when their response starts to be problematic or concerning. I've worked a lot as a consultant with workplaces, primarily nonprofit workplaces, or places where people are working in frontline practice or with vulnerable populations, and similar to them, there's a lot of anxiety, depression. I work a lot with boundary issues, and so definitely I think the survey that you guys did, Barry, shows a lot of what I'm seeing as well. Much higher levels of anxiety and fear, and all the ways that manifests in people's behavior.
Thank you. Graham, would you like to just briefly introduce yourself, and then we can kind of get on to Nick and a broader discussion here.
Sure. Thanks, everyone, for having me. I'm a settler living here in Cowichan Territory, and I practice family medicine both at Cowichan District Hospital and at a clinic in town, Somnos Medical Clinic. I also work at Penelakut First Nation doing family practice, and my background is the Chemainus Estuary, which is Penelakut Territory. That's probably enough for an introduction, and I'll just be part of the conversation as it goes along.
Great.
Thanks.
Thanks. Nick?
Hey everyone. Yeah, so I'm the general manager of the Ramada in Duncan. We've got about 50 employees, of which 95% of them were laid off during the COVID pandemic. Obviously, a lot of stress and anxiety around people's financial well-being. We've got a lot of, we'll call it minimum wage workers, working in the service sector, housekeepers, front desk, all that kind of stuff. So not only were those individuals already financially burdened by minimum wage, but also now they don't know what's going to happen to them moving forward. Will they have a job in 3 months, 6 months, 9 months, whatever that looks like? So we get a little bit of crash back from that, but also just their frontline experience. Those are still working. Are they safe at work? What precautions are being taken place? So a lot of that stuff happened obviously at the onset. I think that there wasn't any closure. There isn't any dealing with that mental state. I think a lot of us are still quite stressed out at work and haven't recovered from that yet. So just basically coming from a perspective of what these employees and frontline workers are experiencing, I think there's a lot of education that needs to happen for them so that they have a better understanding of what they're going through. I've been the GM there for about 6 years, so we've got a lot of good community feeling and connection with the team. So I'm hoping that I can take back from this a little bit of resources and help for those that have worked for me for so long. So yeah, that's it.
Great. Thank you, everyone. So I think, feel free for anyone to ask each other questions or to respond or jump in. But
hey, Barry.
Yeah.
This is Carrie.
Hey, Carrie.
I'm going to try my, see, it's not working. So that's kind of where I'm going to be. But just to introduce myself to the group, my name is Carrie White. I work with Barry in the Community Futures Cowichan building. I'm a colleague of Holly's who set up this meeting with Barry. Just really grateful to be here. I am one that has come to the point where I can say that I've struggled with mental health my whole career, and I'm very grateful that I've had the supports that I've had in place, and now I work in a really safe and supportive environment. But just to the people on the call, like Nick, you're the GM of the Ramada, and didn't you guys do the whole homelessness tent site at the back? And like, just kudos to you and your team for getting that all together. Because you guys did that in town here, or was that not the Ramada?
Yeah, that's right. So, in collaboration with John Horn from Cowichan Housing Association and Mayor Staples, we came to an agreement where we would fill our hotel rooms essentially to make sure that the vulnerable population was being looked after. They did set up some tent sites, in Chemainus and in Ladysmith, not actually on our property. Our property is mainly just housing the folks in the hotel rooms. So we're 100% booked. We're closed as a Ramada right now, and we did a 6-week stint, and that is now extended an additional 3 months to September 30th. So we're going to be looking after these folks for the foreseeable future until they find a permanent solution, hopefully, for where they're going to end up. And it's been a really positive experience. I mean, not only has our staff kind of jumped to, and obviously there's some stress around that and anxiety around that, but they've jumped to support the community, and we've seen some really positive effects from people that have been staying with us that have been able to have a shower and get cleaned up and go get a job, and a lot of really positive things as far as their mental health goes. Their value in seeing themselves has gone way up. So yeah, it's been.
And I want to Yeah, I just wanted to commit. I didn't hear that it had been extended. I saw the coverage that the Discourse did, was a great article that they covered. And yeah, I think what you're doing is probably doing more for mental health in this community, because it spins off, it sends those ripples out. So good on you. I'm so pleased to hear that the Vermont has made that decision. You're a true leader. If you're leading that team, you're a good leader, buddy.
But I think, yeah, the Ramada is an interesting case, right? Because you've gone through a complete collapse in sales and had to lay off workforce, and your pivot has been a positive, starting to make a huge positive impact on the community, which has now had further ripple effects in terms of the new housing that's been announced within Duncan. So I think, yeah, there's some. It shows that stepping up and pivoting can really matter. And I think I heard someone comment that now is the time when we realize that society actually matters, that culture matters, that the way community approaches each other and the way they interact actually makes a difference. And we're seeing that maybe between the differing responses between Canada and US and maybe elsewhere. But I think having a society that is actually taking care of each other and valuing each other's lives is I think maybe a big component towards community mental health as well. So
yeah, absolutely. And I mean, you know, I'll be frank, it was a very hard decision for us to make on our own. I mean, we spoke to all the staff members that were currently working. We spoke to staff members that were laid off. We spoke to other hoteliers in Victoria that had gone through a similar experience. You know, it's really tough to make a decision to put our livelihood on the line, and as well as the property itself, what's going to protect us from damages and things like that. And is the staff going to all quit because they don't want to work in this facility? So lots of things that we took into consideration, but we're seeing the positive effects in not only the mental health of our guests and the way that they see themselves, but the community itself should be, should have less of the transient population walking around and in front of their businesses. These other hotels, all of us, we wouldn't be able to survive this thing alone. So now that they've taken out one of their competitors, the other hotels are getting our rooms that we normally would have sold, right? So economically, it's helped out the community. You know, it's helped out other hoteliers. It's helped out the neighbors that don't have to deal with, removing vulnerable population people from in front of their businesses every morning. So I think overall, it's been a really, really positive thing. And you're right, Barry. It does just kind of speak to the fact that we have to look after everybody in our society in order to all succeed, right?
Yeah. Jodie, I think you mentioned like coping, and this whole event has been an amplifier of what people's experiences and their anxieties, etc. Might be worthwhile to speak to what those positive and negative coping events. And I did have kind of a question prepared around like what is a normal rational response to COVID-19 for a business owner's perspective. So that's maybe it might speak to that normal and positive and negative coping effects, and how should people be feeling during this. So maybe you could speak to that, or anyone else can jump in and comment.
I feel like there's a whole range of what would be a normal response, but I think certainly, like feeling a lot of stress, feeling anxiety, a sense of numbness. I see also a lot of anger, which is something that often stems from a sense of powerlessness. So a lot of the time that comes out more in kind of a resistance to change, and just feeling very irritable and angry. And at the base of a lot of those responses is actually fear, right? Because we don't know what's happening. None of us knows what's happening, and we're being forced from a very external source to change. And change is always really hard for us, but it's especially hard when we can do everything right and there still might not be a good result. And we don't know what the timeline is for this change. So a lot of the time people don't actually know how they feel. That's the interesting thing about it. And I actually have a little pet peeve around the word stress. I'm so stressed. I'm so stressed. It doesn't actually mean anything. You know, it almost is like this bucket phrase that hides a lot of feelings and behavior. So a lot of the time how people can actually tell how stressed or how well they're doing, how their well-being might be declining is through their behavior. So what are they doing? And, you know, things that go along with a mental health challenge or having more stress and anxiety in your life are having a lot of trouble sleeping, right? Like not having good sleep over time and having that be like a sort of a chronic issue. The way that we use food, whether we're, you know, eating more or eating different choices, the way that we use alcohol. So that's something that's been documented so much in terms of public health, that alcohol sales, even though no one has any money, alcohol sales have gone up and people are drinking more. Just that sense of irritability and disconnection from our loved ones, often being quite snappish with our children or our partner. A feeling of disconnection, that we can be surrounded by people, but we still feel kind of isolated and that nobody understands how it is for us on the inside, right? And all of those factors often lead us to just make it smaller and smaller and smaller. When the actual action of well-being or the health promoting activity would be to reach out and to connect. So it's interesting how a lot of people's response has been to work so much more, to have their output be so much greater. And part of that, I think, is a fear response that's about trying to control the circumstances. So one of the invitations of COVID-19 is to actually get more in connection with our humanness. You know, there really is no way to sort of super trooper our way through this kind of global pandemic that's unprecedented. There is no normal way to feel. So being accepting of whatever it is that we do feel is really helpful, and being able to name that and talk about it. So then, you know, so I've mentioned already some negative coping patterns, which are, you know, use of substance, food, disconnection, withdrawing. It's really important for people to maintain things that have activities or practices that have nothing to do with work, right? To make sure that they're still doing things that maybe have no direct bearing on the big problem of work or business, but that will contribute to their sense of well-being or their sense of aliveness or humanness. So, you know, things like gardening, going for a walk, making sure that you're connecting with family and friends. It is a little bit of a red flag when you can be surrounded by people and feel still isolated or alone. That's really a sign that we need to reach out for support and start to tell people how we feel. And I think that's what I mean by it being an amplifier, because for a lot of us, that's not our signature move. You know, that's not the thing that we like to do, is tell people I'm struggling. But, you know, if this huge shift in our society can produce anything positive, I would say that's one of the invitations, is for us to just be more open and honest with how it's affecting us, and to get, you know, to get seen and heard in that. And that helps a lot.
Some good insights there.
Jodie.
Go ahead.
I was just going to ask Jodie, you know, with some of these things I'm writing down here, I mean, obviously getting outside, getting some exercise, like you're saying, gardening, try to find a way to connect with another human being, because people are withdrawing and feeling that loneliness, which obviously is leading to some of those depressive feelings and then negative coping mechanisms. With people that are, you know, we live in a community that's fairly spread out, right? Somebody's out in the middle of a field in a trailer living, and they don't really have the resources to access connecting with another human being. Do we have any resources, or is there any way that, you know, without the use of a laptop with a webcam on it, what ways are there that people can connect to the outside world while still maintaining that safe social distancing?
Yeah, that's a really good question. And I think, you know, we're still in a bit of a flux period right now where, you know, it's a little more possible right now in the month of July to actually, you know, leave our homes and go to a place where we could see other people. And for people who don't have technology, I mean, I think, you know, one thing that is happening is there is a lot of connection happening over technology. We kind of lament technology a little bit, but it's actually, in some cases, really helpful. But, you know, a lot of organizations and communities are reaching out over the phone. That's another way that people can connect. We have a lot of good resources in our community that are free, right? So for different people to connect, say, like I'm thinking of Volunteer Couch, and there's tons of services for seniors and things around connecting and around reducing isolation around COVID-19. In the nonprofit sector, there have been a lot of grants that people have been able to get around shifting their services to be able to connect more with people in unconventional ways. So I know that there are not who are, you know, giving people phone calls and stuff like that. Go ahead.
That's awesome. And when you say there's lots of resources, there's lots of resources. For me, you know, where do I direct these guys? If they do have a smartphone, obviously they can use that to Skype somebody or just pick up the phone and make a call. But you know, is there a succinct and single entity where we can send, hey, go to this one page and you're going to see the 30 resources? Are you looking for this to happen for you? Are you looking for that to happen for you? Click on this link and you're going to get connected with that thing. So is there something that we've done or that we have within the community that is a nice succinct list of resources?
That's such a great question. And honestly, yeah, go ahead, Grant.
Great.
Why don't you carry on, Jodie? I'm just looking something up to confirm if it's actually a decent resource.
Okay. I mean, you know, I can say over the years, there have been many, many, many attempts to make the definitive resource for all of the services that are available. But there are a few different ones. I mean, for me, the place that I think about as kind of an information hub is Volunteer Couching, because they kind of function a little bit as a navigation for the community, right? Off the top of my head, I'm thinking of, you know, for seniors, there is a physical book that's called the Senior Services Directory, so there is one of those. Healthcare, I don't know if that's what you're looking at, Graham, is Fetch, so there is the Fetch system where you can, like, yeah, is that what you're thinking of?
Graham's put a few in the chat here. Go ahead.
Yeah, I've just put 2 links in the chat. Fetch is not really being used anymore. So the new resource is called Pathways. And there's 2 parts of Pathways. One is something that providers can use, but it's a real attempt to capture all the health and social services in the community that people can access. And so there's been a reach out. I don't know if you've been contacted to put your information up on there as private counselors, but it's run through the Division of Family Practice, which is the nonprofit organization that supports the family doctors in the community, and it's a provincial network. And so Pathways has a ton of information about various community resources. And then if you want access as a provider into it, I can set you up with that too, so you can see information about other services at the professional level. But it's our latest attempt to try to keep information there so that we can refer people to one area for resources. And then there's also some more generic online things posted through the BC CDC about managing mental illness and stress during COVID. And there's some links to Anxiety BC and other programs that are free and available online. So
I just want to acknowledge that Tina mentioned that Couch and Family Life is still providing affordable counseling over Zoom. So that's always been an affordable counseling service that we have in the Cowichan Valley. And also there's BC 211, and I know that is a province-wide resource that's trying really hard to be a comprehensive a database for all resources in all communities. And I know that they've actually, you know, had a big COVID-19 response as well in trying to be more comprehensive in what they're able to provide for people regarding COVID-19 and the additional stressors. So that's another option.
Yeah, and this is Carrie, and I posted a link to the League of Innovators. Part of my role at Community Futures when the pandemic hit was to collect and disseminate all the multiple resources that were coming out as a result to provide supports mostly to small businesses and entrepreneurs. I just found this site really resonated with me from a wellness perspective. And even though it's sort of dedicated to entrepreneurs, they have some really good, even the fact that on their landing page, they have a spot where you just breathe and you breathe on a countdown for 6 minutes. When I landed there and I did that, I was like, oh my God, I feel better already. So yeah, just out there for perhaps some people might find some resources there.
Just jumping on kind of one of the comments around space for people to connect and meet. I was talking to one Cowichan business owner yesterday, and he commented that how many businesses rely on volumes of people in order to stay financially viable, while people are also relying on these business spaces as a place of community gathering. And within this crisis, both are simultaneously under threat, which is an impact of both, you know, the mental health of business owners and society at large, and kind of a long-term threat to our social gathering spaces as these businesses become under threat. So I thought it was really poignant comment that kind of builds upon what we've been talking about in terms of maybe the loss of that space. Things have moved online and virtual, yes, but I think people also tire of that. And you know, if businesses can't keep operating into the future, then one, we're going to have a loss of those wonderful spaces, and the economy is going to suffer, and employment is going to suffer, but also we're going to lose public space for people to gather. So that I'm not going to add any question to that, but I thought I should include that in terms of what we're discussing here.
And that's awesome that you bring that up here, because
go ahead, Nick.
From our perspective at the hotel, you know, it's a daily conversation. It's a check-in on the well-being of the team, because they chose a job that was very socially active, and when you take that away from them, you know, you're removing them from what they've chosen as their livelihood, because it does connect with other human beings. So, you know, they have a really hard time sitting at a desk that no one's walking up to, and how do you engage with them more socially and whatnot. I did do some research on this a few months back when this was kind of hitting a bit of a pinnacle for us, and sent our team out an email that had a bunch of resources, whether it was something called Mind the Bar, the nonprofit organization based out of Vancouver. Worth Hats is another Vancouver-based company supporting mental health initiatives, giving free counseling. Restaurants Canada, things like that were for social, or not social services, but services for people in the service industry. And I think my next question, in hopes that we can use these resources if we have the motivation to use them. If someone says, I want a six-pack, I mean, the answer is pretty easy. Stop eating chocolate and do more sit-ups. So the answer is there, the resources are there, we can feed them those resources, but it takes them to get off their ass and make the phone call. And I think that's a really hard thing for someone to do who is depressed, who's feeling anxious, who's withdrawn from society because it's been mandated that they withdraw from society. So to get them to get off their ass and motivate them to pick up the phone to call, I think that's where, you know, I feel like I'm a counselor. How to do something for yourself, because you need to. You're mentally unwell and you need to do something about your mental health. So is there any strategy, or do we have any kind of advice to give to these people that are having a hard time standing up and moving in the positive direction that they need to?
I could talk a little bit about that. You know, I think it sounds, Nick, like you're like a really engaged employer. You really care about your people. And I think, you know, if we're talking to a business community here, so different businesses have different kinds of cultures about how they see their employees. And I mean, and even if the intentions are positive, there might be, you know, big blind spots. So, you know, people, you know, I work a lot with people who've been injured at work, and most of the time, what they want is like, you know, they've been off work for a couple of weeks, from a manager or someone, just a phone call to, you know, feel like that they're cared about, right? It's not really what you say. And, you know, it sounds like you're already doing that. You know, it's like you're already showing your people that you care about them. And I think that's, you know, I think it's understandable that a manager or supervisor would have concern about the privacy of their, you know, of their people. And I think that's, you know, for the thing is, we're not really dealing with like a homogenous group when we're talking about people who work for you. It's like everybody. I would say most people, though, just want to feel like someone cares.
And I really appreciate that advice, because that would be huge for our team. I mean, we've got some people that are used to engaging with customers who are walking in the front desk, and they're engaging with these hotel guests, and now they have no one to talk to, and then we have a whole bunch of staff that are sitting at home with no one to talk to. Maybe our front desk staff can, as a daily, you know, call 2 or 3 people that have been laid off and just check in with them and say hi and see how they're doing, and it kind of benefits both of them, right?
Yeah, what I would suggest is to, if they're going to call them, to preface it with, you know, are you okay with us contacting you? Like, we want to contact you just to see how you're doing. Are you okay with that? It's like, you know, sometimes people sort of put on a brave face and they be thinking, oh, I have to talk because it's work. Otherwise, I'm a bad, you know, employee, right? So it's like when we're kind of shifting from, you know, like work tasks to mental health, there's all this permission stuff. You know, it's like, you know, if you have an employee who's got to wash the dishes, you're not going to ask, is it okay if I ask you to wash the dishes, right? You know, that's part of their job. So it's kind of hard because you're shifting gears into someone's personal life. And we always need to keep in mind of asking permission first. And that also, you know, I think people feel really respected when they hear that too. But yeah, I think that's a great strategy, you know, just to use people's time to do that. You can also say, you know, if people do want to be reached out to, you know, would you prefer a telephone call, email, or a text? You know, because some people want to hear a voice and some people, you know, that's too personal, but they kind of want to, you know, if they got a text, that would feel good for them.
That's great advice, Ben.
Yeah, I just like to comment too. I do some work with staff teams about how to stay connected during COVID, or even more generally, how staff teams can communicate. And I think what's really helpful, right, especially right now, we all need each other so much more. Like, especially if we're lucky enough to have a work community, like it can really offset the isolation, even if people aren't all together in one site. So I think it's helpful to just empower staff with a little bit of knowledge around what is helpful and what is not helpful, right? So things like gossip or venting or, you know, sort of chronic complaining or divisive talk among a staff team is really not helpful, even though it might feel helpful in the moment. And empowering and just listening and holding space for their colleagues, and in a boundaried way. Like, you know, there definitely has to be an understanding of like when that's too much. But I think it really, like, this is an opportunity for us to really value peer support and understand that even though we just, you know, we might not be friends, we just work together, but these are the people that we see, these are the people that we know, and being able to just talk about, have little check-ins and say, yeah, I'm not doing so well, or I'm doing better today, you know, and to know that that can be an exchange, and that's just a way to get seen and heard in whatever it is we're feeling. And relative to the motivation piece, I mean, I really do get that. I mean, I think we all have people in our lives that we wish were more well and don't take the steps to become more well. But I think that's another great workplace opportunity, is to just create this culture where wellness is something that's talked about. It's normal. We're going to keep mentioning it. We're going to keep saying, how's everybody doing? How's everybody's mental health, right? And I feel like it's almost like, you know, a radio ad. You have to hear it like 6 times before you even realize that you've heard the ad. It's kind of similar. It's just got to be in the water. It's got to be in the air. This idea of like, you can feel better, right? And then with that, I also want to say there's got to be a lot of compassion. There's got to be a lot of compassion and self-compassion and like unconditional, like, yeah, you're smoking a lot more and we still care about you. It's not conditional. Like, it's not like we're only going to support you and be there for you when you get it together or if you're taking action. You know, it has to be kind of like a wraparound thing where we have compassion for people in all of their different levels of struggle.
That kind of brings up so many things. Maybe in terms of like peer-to-peer support within the business community between different managers and business owners. Nick, do you know how much that is happening within the community right now? And then maybe out to the group, like how valuable is that? And is there a good mechanism to do that? Do you need a counselor on the call with you, or is it get a bunch of business owners to jump on a Zoom call together or meet socially distant and go, this is what I'm dealing with, like my life is a mess, but I'm hoping your life is a mess too, so we got something to talk about here. You know, I think, yeah, I'm kind of wondering where's the right fit for that within the whole broader community.
Sure, and you know, one of the things that we did when this all started off is we reached out to the other hoteliers in the area to say, what's happening at your property? How are you surviving this? What processes and protocols are you putting in place to make sure that everyone's safe? So the conversation started a lot around logistics of how are we physically figuring this out together? You know, how are you spacing your tables out or whatever that might look like? But it found that it connected our hotel community quite a bit more, and maybe not everybody, but a few that engaged with picking up the phone and having a conversation. And, you know, professionally speaking, how are you today is always answered with, you know, I'm fine, I'm great, I'm doing very well, thank you. When really deep down inside is like, I'm having a hard time surviving and I need someone to talk to about this. So some of us have been able to open up a little bit within the businesses, a little bit more B2B, but unfortunately, business to business has never been like that. It's been mandated that it's unprofessional to talk about your family problems, right? So you don't talk to people within your community about that when we're discussing work things. So, you know, I don't think it happens often enough, and maybe it's not the right place for it to be happening. That we should be reaching out to these resources and counselors and professionals that are actually you know, certified to do this kind of support rather than commiserating with another hotelier. That being said, there's nothing better than grabbing a beer with another person who's running a pub that's running into the crowd and saying, yeah, fuck, I'm in the same boat as you, man. Like that's a really good thing. But it does open up some vulnerabilities to the actual business and to kind of crossing that line, I guess, which has always been there as a part of society, but maybe that needs needs to shift a little bit.
Yeah, I think that's a good point. Like, is this the opportunity that we have, a rare opportunity to destigmatize mental health, and for broader society to go, okay, everyone has been impacted by this. Everyone is feeling bad. Hands up. Everyone can put their hands up and say that they've got an increase in that stress bucket, whatever that is, and your resultant behaviors have altered. I know I'm eating more chips and eating more chocolate, and I need a massage, which I'm not getting, and probably drank more alcohol as well, and not getting enough exercise as one person. But I know I'm not alone. And I think that also the uncertainty of people were saying, okay, let's hope we've quelled this within BC, and businesses will be able to open up. And now people are going, oh crap, second wave is, pending, it could show up anytime, and that elongates that kind of sphere of uncertainty where, yeah, you do have no control over anything. So I think those feelings are not necessarily diminished. We're kind of in a situation now where people are coming out and going, okay, we're back to some sort of normalcy, yet any moment down the line, there's that fear of things could shut down, and you can ramp up your business, and 2 weeks later, you might have to readjust it again. So maybe kind of go around to people and have that discussion about the destigmatizing mental health, and how as a community can we go about doing that, because I think that's maybe critical to the broader societal issues to do with drug abuse and overdose deaths and alcohol abuse and suicide and all these things that we don't generally feel comfortable talking about. But I feel like a whole segment of society, if this is the edge, whole segments of society has just shifted past that edge. So yeah, I think that's a worthwhile discussion to have maybe in this context as well.
I like that idea, Barry. And some things that I'm hearing is that business owners are opening up saying, I feel this anxiety and fear and all these things that go with the changes that came to their business through COVID. But then it makes them feel even worse when they hear of another business that's being successful, and they think, well, now what am I doing wrong? What's wrong with me that this person can, survive and thrive and do well, and I can't? And they're taking it personally now. And I don't know that there's a place to turn for them to hear that these are all different scenarios, and every business and person has different resources, and they approach things different ways. But they think it's an extra failure on their part, happy for their co-business people, their colleagues, to do well, but then they kind of internalize that and go, there must be something wrong with me because I'm still struggling.
So, I could talk a little bit to that. There's sort of different things sort of want to touch on. One is that, there's sort of layers of support. So you can have like a business group, like sort of a support. If you just think about things like Toastmasters or some of the business groups in the Valley, where, the theme is motivation, right? It's like you're supporting each other in motivation. And that creates a container, creates a boundary of like, okay, this is what this is about. You can have like a COVID support group, like a business-based COVID support group, which would be, where the boundaries is we're talking about, the impacts on our businesses and how to optimize our business experience in this time, or how to solve problems, or how to share the struggles, because so that we're not in a vacuum. And then the other layer would be like a sort of a mental health thing where, we're dealing with our personal emotional experience, And so I think it's important for people when I think it's important to have these groups that have these ways of connection, but people want to feel safe, right? So if they feel like, oh, well, they're having a counseling group for business owners, well, I don't want to talk about what's going on with my wife or whatever, so I'm not going, right? Or I'm not going to join that. So it is important that people know what the boundaries are. What are we going to be talking about? And that might sort of create more openness to that. So similarly, what you're talking about, Jill, is like, if we're having like a support group for businesses in the Valley, and it's like, solving problem, the theme is solving problems, brought up by COVID, then, we're not looking at like, or what are the successes per se, or if someone's talking about their successes, they're joining that group to, kind of help other people or to give suggestions or things that have helped them per se. I mean, we're in a changing paradigm, so there are businesses that are going to thrive just because of the context of the paradigm, and there are businesses that are going to do less well, like a lot of the service industry, it's going to have a hard time. So, these are the things that, people kind of need to know going in beforehand. If it's just sort of a open kind of group, then someone might say, hey, I'm doing awesome, and it can have that impact.
I also just want to quickly say that, what you're talking about there, Jill, is an underlying mental pattern of comparing ourselves to other people. And we know that actually leads to much more stress and mental distress, right? So again, I think that's kind of like what I mean when I say COVID is the great amplifier. We already have that habit of like comparing ourselves and seeing if we're successful relative to other people. It's just going to get bigger in a COVID unprecedented stressful time. And if I were that person's therapist, I would say, hey, let's look at your assessment tool here. That's not even valid. We always feel, for every time we feel better when we compare ourselves to someone, we're going to feel worse like 10 times, right? It's just not a good way to do life. And so I feel like that's one of the mental habits that we know doesn't make us feel better. So it would be just a little work on just refraining, from comparing and understanding that that's not actually going to be helpful, especially now.
I think Tina would like to join the discussion here. Tina, if you want to turn off or unmute if you're not unmuted, and if you have any comments or questions to the group, I see you added some stuff to the chat here, but feel free to talk openly here.
Okay, thanks. I just basically wanted to talk about a couple of coping groups that I've been using. About a week before this whole shutdown happened with COVID, I actually underwent hip replacement, so I was kind of self-quarantining before everybody else. But anyway, what I have found throughout this, through Zoom, I was able to keep in contact with a wonderful support business group where one person from non-competing, but it's a different kind of group in that we believe that building trust and relationship is utmost before we could actually refer business to people. So that we meet weekly on Zoom because of COVID, and it's been really helpful because we have really good discussions. It could be whatever happens to be what they want to talk about if there's an important issue, and we give each other advice that way, or just whatever, or we have table topics that we talk about and we meet for that. But on a personal level, all my family is in different cities, so I have a weekly Zoom meeting with my cousins, and we get to connect and support each other that way. So anyway, that's my 2 cents.
Thanks, Tina. And I think, yeah, there's great value to having those groups. But yeah, I think trust seems to be, the key binder of those, and to create those boundaries for what those groups share. And yeah, maybe if the topic is mental health, people mightn't show up. But if it's got some other topic and there's an openness to discuss how people are doing, and there's trust that whatever shared stays within that group, I think that might create that openness for people to start to reveal some of the issues that they're sharing. We're coming up to 1 hour here fairly shortly.
Can I add a few words?
Yes, please do.
Yeah, like I'm very grateful to be part of this conversation, because I'm involved in managing the small practice that I'm in, as well as seeing patients individually. And, we've seen a great change in how our flow in the office works, and a huge increase in demand on our front staff, as now people are wanting access to us, but it's still difficult and very different. Just a couple of things that have come to mind when we're talking about trying to how to support other people. And I really appreciate what Ben said about sort of boundaries and knowing the goals of the group or the interaction, and how Jodie's talked a lot about compassion for ourselves and for each other through this. I think those go a long way in just sort of clarifying what our intentions are for the people we're with, and what exactly the relationship is. And I think when we start conversations about this, how we frame the initial question or the intention is really important. And to really respect others and help them find their own motivation to change. I usually like to start by asking people of how are they managing? How are they coping? What's working for them? What would they want to do more of? Because I feel like there's like this huge weight going around on us that's there. And if, like, we have to acknowledge that and understand it, but how we engage initially in a conversation to look at our strengths and our resources and get people thinking sort of forward in that way, I think can make a difference for people finding their way to sort of the next step to make themselves a little bit healthier or a bit more connected or whatever it is that they want to do. But I'm just always conscious, like in my job, when I talk to people, sometimes I feel like we're moving back and reflecting on things, and that's really important. And sometimes we're really kind of moving forward about what are the next steps to getting healthier. And I think just being aware of the kind of the flow of the conversation and having sort of resources that if people are getting kind of overwhelmed and so on, how to get back into basic care for ourselves. And also having time that's really focused on sort of the next step of surviving, thriving, getting a little bit better.
Thanks, Graham. Maybe one question that business owners might be wondering about our staff is how a company's benefit plans, if they have any, can support mental health counseling. In your practice, is that generally through private healthcare providers that can benefit from counseling services, or how's that working? And I see Graham's got to leave us here, and I think we're going to wrap up in a second. Thanks so much, Graham.
Hey, Graham. I know we talked about this, Barry, and I think it's maybe something I can speak to. Different businesses have different, some businesses have no mental health services. They're not a big enough business. There are some businesses that provide extended health coverage to their employees, and that can include a certain dollar amount for counseling that they can get reimbursed through. Some businesses provide EFAP, which is Employee and Family Assistance Program, which is sort of a directed counseling service. So they'll have access to a certain company that provides services. And then of course there's the Duncan Mental Health, whose programs are changing. I can't keep up with what services they provide at what time. I mean, it seems like the services change. Sometimes it's easy access. Sometimes it's very restricted access. What I would, I worked a lot for the Employee and Family Assistance Programs at one time, and I don't work for them anymore because I'm not really impressed with the service they provide. And I would encourage business owners who provide, or business managers who provide that service for their employees, to survey their employees about the level of satisfaction with the company that's providing that service. Because there have been like one or two companies in Canada who have kind of gobbled up all the smaller EFAP companies over the years. And, with competition, it's like when you have a monopoly, you can provide a cheaper service to your clients, the clients being the businesses who are hiring you, but also a poorer service. And so I would encourage, managers and owners to survey their employees to see how effective that service is. And
so I think maybe the key is right now for staff to check what your benefits plan covers, and for managers to maybe test out the mettle of that service and to see, maybe try it out for your own purposes, and check with your staff on the effectiveness of it. So yeah, thanks, Ben. And I think we've got to wrap this up because we're right at 1 hour here. So I really appreciate everyone joining and taking the time, and this will be available for people to watch afterwards. And I'm hoping that some folks will take the time to do that, because I think it's been a really valuable conversation. So on behalf of Economic Development Cowichan and Cowichan Strong and everyone here, I just want to thank everyone for participating in this discussion, and we'll leave it for today. If anyone's got any last 10-second closing remark, then welcome to throw it in now. Otherwise, we'll close off. Thank you so much.
Thanks, everyone.
Thanks, everyone. Appreciate it.
Bye.